So we're looking at the neonatal record. We have looked at the maternal record, which just have to do with you are monitoring a woman from when she's pregnant, when she gives birth, after she gives birth. So you're taking into records, you are recording everything. You understand? So neonatal record, just like the name implies, neonatal is newborn. You understand? So record is just have to do with you are monitoring the baby, is their health. Okay, primarily is their health. Okay, and you are putting down the record. Of course, this will help in documentation. It will also help in all those legal stuffs that might come up. So it's just a detailed clinical document. So it's used to track the health, care, progress of a newborn. Okay, especially during the first critical days of life. Of course, a baby is not a newborn forever, so it's not just within that first month that they give birth to them. No, so it's essential for ensuring continuity of care. All right, you can be able to dictate complications if they are there at all. Okay, and accurate documentation in both routine and intensive settings. So what would you actually find in a neonatal record? That's if they give you the book or the document, what are the things you find there? So here we have the section, then right here we have the details captured. So you might just want to pause this video to observe the details captured. I'll focus more on the section. So identification, you're just trying to put the baby's name, and all of that, sex and all of that, date of delivery. Maternal history, you are trying to take history of the mother's health all this while. Has she had any disease condition? All right, birth details, like how was the baby born and all of that. As they were born, how was their health within that time that they were born? Okay, then initial assessment. Okay, routine care. All right, risk factors. Okay, was the baby premature? Was there low birth weight and all? Intervention, like what was done, progress note, discharge summary. Okay, by the time you're sending the baby and the mother back, what was the condition? Okay, so specialized neonatal record, if the baby is in intensive care unit, the record is different. That one, they are basically you are monitoring vitals, blood pressure, pulse rates, medications that are giving the baby, feeding procedures and all. Neonatal admission record, this one is basically for admissions and all of that. Okay, so just so you know this record and what it means.